move. They don't treat what the patient needs. And I've seen that so many times, and it's absolutely distasteful. So, you got to be your own best health advocate and find a doctor who's willing to look at things deeper, look at different angles, look and figure out those complex questions that no one else took the time to really figure out. I know you do that, and I love to do that too.
Hi, I'm Dr. Monica Jauregui, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live fully. Ready to explore what's possible and be truly healthy? Hi, I'm Dr. Monica Jauregui, and welcome to the Truly Healthy MD podcast. Today we have Dr. Jeff Gross, and he is a pioneering physician blending expertise in neurosurgery, regenerative medicine, and longevity science to deliver transformative patient-centered care. He began his academic journey with notable early achievements, including publishing research. Dr. Jeff has successfully treated thousands of patients. That is so cool, emphasizing on non-surgical and regenerative approaches like stem cells and exosomes, earning international recognition for his innovative work. His research contribution, including widely cited publications and authorship in medical textbooks, solidify his role as a thought leader in neuroscience and regenerative medicine. So we give a great big thank you and welcome to Dr. Jeff. Thank you for being here.
Yeah, thank you. It's my honor and pleasure. Thank you for, sharing all that. That the paragraphs go on, and I can't believe I'm still doing it.
I know. I love giving those intros. I'm always like, wow, what an honor. This is so cool. Thank you for being here. And so today we're going to talk about one of your favorite topics and something that a lot of my listeners are really into, which is regenerative medicine and the current applications. So
Yes.
Within those, I know one of the biggest things is stem cells. Is that one of the biggest parts of your practice?
Yes, we use that phrase stem cells, to sometimes interpose or change with regenerative medicine, which is tapping into stem cells and signaling factors and other particles that are derived from stem cells. So they're all one group together.
Okay. So it's kind of interchangeable lingo that we can use.
Yes, for the layperson, yeah, people know the phrase stem cells generally, like, oh yeah, I've heard of those. Those are cool. They might help me. And I'm here to talk about not just stem cells, but all the related biologics, we can say biologics, that we can use to get a regenerative benefit, to help restore, renew, heal, and help the body naturally do what it knows how to do, but needs a little help.
Yeah, and that's amazing. That's what I love about this cutting edge science, not just put people on a treatment that they're going to have to use long term, but if we can actually restore function, that's the best thing we can do for our patients. So this is really at the core of what we do in this integrative functional space. So this is an amazing talk. So as far as the different applications, I've heard that you apply this, for example, to painful joints and spine issues. What kind of applications do you see the most for this?
Yeah, well, my background is in neurosurgery, particularly spine neurosurgery, based on my fellowship. So for decades, I took care of so many people with neck and back pains and injuries and pinched nerves and disc issues. And I was always trying throughout my career to avoid surgery for those people when I could. And I think my rate was less than 5% of my patients ever needed surgery. So I was proud about that, but always trying to get it down even lower. And my patients came to me and said, hey, well, I don't really want surgery yet, but I'm still having issues. And the usual treatments and therapies and injections didn't work. How about this? How about that? How about stem cells? So I said, you know what? Let me look into that. So that's how it all, came about. And that's why the low-hanging fruit is spine and joints. And now I've branched out into joints because now that we have this tool, this regenerative tool without pharmaceuticals or surgeries, I can apply it to joints and for various other issues. So my scope has expanded beyond spinal care.
Yeah, and that's awesome. Just being an internist myself, I can't tell you what a large percentage of my patients have some underlying back pain, joint pain that really limits their ability to live a healthy, fulfilling life. I want them to be out there doing exercise, playing with their grandchildren or even children sometimes. And these are things that such a large majority of people deal with. So that's so amazing that you can offer this.
Thank you. Yes. Well, I'm lucky to be able to do it. I'm lucky my patients suggested it, and I have a renewal, a new energy in my practice, sort of a version 2.0, a reboot, and now I'm full steam ahead with regenerative medicine for so many issues for people. But the low-hanging fruit, the things we get great results with, early results, tend to be joints and spine.
Okay. And when you have a patient come to you with these problems, are you able to quote them as far as like their likelihood of getting better? I know it's going to depend on the patient and their condition,
Yeah.
right? But are you able to give them numbers, or do you just have to say, hey, everyone's different and we can't really tell you that data? Do you have that data yet?
I have data. It's not my own, and I'll say it for this reason. And what we talk about here today is for educational purposes, because the FDA has not yet approved regenerative medicine for marketing claims. So I am not allowed to claim numbers.
That's true.
However, I can show people research articles, medical journal, published articles, and everything we do is based on good science. So, for example, the way I approach joints, it's based on a European article, a set of articles actually, out of France, where they have published over 15-year follow-up. So we follow that protocol, and I can show those results where in their particular approach at the 15-year mark, over 80-some% of the patients were still doing well and did not need a joint replacement surgery that they were recommended when they entered the study, but didn't have.
That's pretty cool. That's great. I'm glad we have these numbers because, we all want to be evidence-based. And I
Right.
think some of the problems that we run into when we talk to our colleagues who practice very, very, very conventional medicine is that they tell us, you don't have evidence, you don't have numbers, but we really do. So I
Yeah.
love asking those questions. I'm glad that
Yeah.
you're able
I'm glad
to
you did.
get these things. Yeah.
Yeah, I'm glad you did because the phrase evidence-based medicines gets misused, right? And evidence means, some good study, good work, or multiple studies, or something like that. Not just what a health insurance company will pay for, because they misuse it all the time to deny care for people in need.
Yep, that's so true. And I feel like conventional medicine doctors that are on the straight and narrow feel like they're the keepers of evidence-based medicine, and it's not true. I feel like a lot of times what we do in integrative medicine, we're actually more at the forefront of
I agree.
the data. So I love
I
presenting that
agree.
to our public so that we can have this communication with the public and with conventional medicine so they understand what we're doing.
I totally agree. And I'm sort of migrating to colleagues like you, because that straight and narrow that you mentioned is really so narrow, because when they drink the Kool-Aid, it narrows that field, and all they can see is what, they treat what gets approved. They don't treat what the patient needs. And I've seen that so many times, and it's absolutely distasteful. So, you got to be your own best health advocate and find a doctor who's willing to look at things deeper, look at different angles, look and figure out those complex questions that no one else took the time to really figure out. I know you do that, and I love to do that too.
Yep, amazing. So tell me more about like the painful joint and spine issues that you treat.
So, you know, there's a process that happens to us as we age and as we accumulate chronic inflammatory changes in our cells. And of course, the word aging and the word chronic inflammatory, or inflammation can be sort of brought together because they're sort of the same pathway of cell activity. And some people call that inflammaging. And the slower you accumulate those inflammatory damages to your cell, the slower your age biologically. So we're trying to work on that from a preventative standpoint. But when we see people who have suffered a lot of that, one of the earliest places it manifests is in joints. Joints degenerate because the cells that make cartilage, called chondrocytes, and for those of you listening at home, there will be no quiz, but you don't need to memorize that word. But the little cells that make cartilage, that make the meniscus in the knee, that help make part of the disc in the spine, that help make the little synovial fluid and lubricating fluid in the joints of your knuckles, comes from the bone. And those are in the bone edge in what used to be called the growth plate. And when you were growing, that factory was making cartilage and other cells like crazy. Well, those are very sensitive to your inflammation in your body. And, inflammation of the joints affects those, and those cells cannot make cartilage anymore. And that's called osteoarthritis. Of course, the itis refers to the inflammation. Osteo refers to the bone. Arth refers to the joint. So it really is a bone joint problem, not just a joint problem. And what happens these days, you go in and you get cortisone injections and lubricating injections and x-rays, but they're targeting the cartilage, not the joint. That's like saying the cells in your scalp that make the hair, the source of the hair. If you have a problem in those cells, just put something on your hair. Well, that's not going to work, right? You're just treating the protein product. So injecting the cortisone into the joints actually accelerates the degeneration, although it may calm some inflammation. So I attack the bone through those European protocols by helping to use regenerative medicine to re-stimulate the cells that are causing the osteoarthritis, those chondrocytes. And some people call that bone on bone, or they call it wearing down of the cartilage, wear and tear. You can accelerate that with an old sports injury, or having had an arthroscopic or scope surgery can accelerate that. So I help those people by first identifying the problem, examining them, getting a proper MRI, because not all MRIs are the same, not just an X-ray, to look for the specific targets. And we can see that inflammatory stress in the bone edge. And then if they're a candidate, we inject those areas with the regenerative biologics derived from stem cells.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support. That's really cool. Very, very cool. And so with these patients, is there an age limit? As obviously the older people get, the more likely they are to have these problems. Right. Do you have to turn down people who are older, or can you offer these to people no matter the age, obviously case by case, but what's a general approach to that?
No, we haven't had an upper limit. If there's a reason someone can have an injection, like they're on severe blood thinners for some other problem, that might be one thing. But no, we haven't had anyone we've had to turn down. We have had people who aren't candidates. Maybe there's no target on the MRI, or they've got, some other problem. But by and large, anyone with any degree of degeneration, even bone on bone, because when you really look close, it's not exactly bone on bone, unless the knee has fused itself together and doesn't bend at all, for example, are potential candidates. Now, we only invite people here to my clinic in Nevada, in the Las Vegas area, if they're candidates, and we do most of the work remotely. We order the MRIs if they need them. We have them ship them to us, and we look at them share a screen. We do all the remote work, and we make sure everyone's optimized first. You got to have your diet clean. You got to, make sure you're living right. You're getting restorative sleep. You've got the right, macros and supplements, and maybe optimal hormone management. We exercise, everything we want you optimize, because anything we do in the stem cell field will work better if you are optimized.
Yeah, absolutely. I think that works the same for a lot of the things that we do in this type of medicine. I treat a lot of chronic infections, and it's hard for me to get results if people are not nourishing their body right, fueling it right, doing the exercise, sleeping right. If we don't optimize the immune system, I can't help them with those chronic infections. So I think that's a pretty standard thing in what all of us do. I hope that's not a shock to patients. Be like, hey, just give me the injection. I don't want to do my job,
yeah.
right?
Right. They got to do the work. They got to do the work. So
They got to do the
we can
work. And they're
help,
gonna,
but they got to do their
yeah,
part for
yeah,
sure.
and they're going to have much better outcomes and outcomes
Right.
and other things that maybe they didn't even know was a problem. But
Right. Exactly.
yeah, absolutely. And so, what are the like hyper-inflammatory issues that you treat? I've heard of like autoimmune things, of
Yeah.
post-infectious things. Can you tell me more about that?
Yeah, because regenerative medicine works to reactivate cellular pathways to combat inflammation. So you think about our cells are responding to the world. It's dealing with what's additives in our food, in the water, electromagnetic field, everything that we shouldn't be, fast food that we shouldn't be exposed to. Our cells are busy in defense mode fighting that. That's chronic inflammation. So regenerative medicine works against that. It flips the cellular pathways into one of optimal functioning. And that's why your chondrocytes can make cartilage again. Well, your whole other cells in your body can be affected in the same way. So if you have a chronic inflammatory state, like an autoimmune problem, rheumatoid arthritis, thyroiditis, and many other types of autoimmune, um, you know, just suppressing the inflammatory burden in your body can have huge benefits. And we see that in many patients. We also see hyperinflamed states like you probably do in these chronic infections like Lyme's,
Mhm.
like long COVID, and others, chronic bronchitis and things like that. Well, we can help suppress the overactive and inflammatory state that got started and doesn't turn off. And we get benefits there in those settings as well.
Okay. Yeah, that's great because that just feeds into a lot of the things that so many patients have chronic illnesses, a lot of inflammation, autoimmunity going on, and it's the burden to our society is huge at this point. So that's great to hear. Um, and so I know people are all wanting to live a little bit healthier, a little bit longer. There's some people that consider themselves biohackers. Is this what people that are in the biohacking industry do they look to you for these sort of
Yeah.
interventions? Fatigue, brain fog, mood swings, weight gain. If you're a woman in your 40s to 70s, you've probably been told that it's just aging. But what if it's not? At trulyhealthymd.com, we look deeper. Hormones, nervous system health, hidden toxicities. You're not broken. You just need a doctor who really listens. Visit trulyhealthymd.com and book a consultation today. It's time to feel like your real self again.
Some do as well. So we have healthy people that are working hard to live longer, healthier, and healthier longer. And those people come for preventative, treatments. They come for optimization of their sports performance. Let's say these aren't, necessarily. These are like weekend athletes, pickleball champions, things like that. We do have a few professional athletes, although we're not allowed to mention them, who do this, and they come to get more out of their physiology, out of their body's functioning. And we do all kinds of different tests, inflammatory markers, biological age tests, because your actual age on your birthday may not be how your cells look and feel, or your bloodstream looks and feel through other markers. So we call that the biological age. And you can see this, right? You look at, if you see two different 75-year-olds, one might be very frail in a nursing home and look like an elderly great grandmother, and one might be a vibrant golf playing, socialite who's still out there. And they're both 75 on the calendar, but one is more youthful biologically or physiologically. So we can test that with some different tests and then use the regenerative medicine to help those who desire, keep their biological age younger than their actual age.
Yeah, that's super cool. And yeah, I was just at the gym yesterday. I had to ask the person next to me. I was like, "Can I ask how old you are?" Because I could tell just from the look of the hair and the skin that he was quite a bit older than me. But he was lifting a lot more heavier weights than me, and I love seeing that. I love seeing people who, as they age healthily and gracefully. It's very cool.
Yeah, agreed.
Yep. And so are there any people that, apart from the people who don't want to do the work, right? They don't want to put in their effort, eating right, exercising. Are there any other people that you would say are not candidates for the type of interventions that you have?
Well, currently I'm not treating anyone who has active cancer, not because the biologics um, might do something wrong, but because we just don't know enough yet, and I'm waiting for more evidence-based, medicine to come out. However, I am working on a project I'd like to plug here since we're talking about cancer. And, there's a subset of the immune system that we have called the T cells, and there's a certain type of white blood cell. And there are a certain subset of those that are called natural killer cells. Well, natural killer cells are probably less than 2% of all your circulating white blood cells. And they go around, as you know, Doc, and they go around and they selectively identify, messed up cells, maybe senescent cells, cancer cells, because we have accidental cancer cells all the time. And they're going around, oh, found one, and they kill it selectively without harming normal tissue. Well, those cells make little vesicles that do the work. They're called the NK cell exosomes. Exosomes is short for extracellular vesicles, and that's a form of regenerative medicine. We use a lot of stem cell derived exosomes, but these NK exosomes might be an amazing adjunctive helpful care for addressing cancer, maybe as a preventative in people that are high risk, maybe in between chemo and radiation or instead of chemo radiation. So we're looking to get our hands on these. They're available in China and some places in parts of Europe right now, and we're trying to get our hand on these and make them available to people who are looking for alternative and holistic natural approaches to cancer care.
Yeah, that is super, super interesting. And I'm glad that's expanding to that. There's so many people that need that. Um, in general, and this is probably just uh, the information that I've heard so far, whenever I've heard people wanting to do stem cells, I've heard that people usually have to travel overseas to get this. Is this a something that's growing in our own country, or how easy is it for people to access this? I'm sure that people are going to be looking you up after they listen to this podcast, but how easy is it to access in our own country?
So, historically, you did have to leave the country. 20 years ago, the professional athletes would leave and go to Europe and what have you. And so places in Europe, in Asia, and probably in the last decade and a half, Central America, Mexico have plenty of regenerative medicine clinics and stem cell clinics. They've been doing it longer, and that's why we're tapping into their knowledge. But we have it here in the US. We cannot advertise. We cannot advertise regenerative medicine on Google or Facebook. Now, hopefully that might change under the new administration and we can have some more freedom there. We cannot make any claims, of course, as I mentioned, marketing claims. And a lot of those other clinics outside the country can, but you do not need to leave the country. We have it right here in the US. Although we're late to the party, we're doing it right. And the suppliers of the stem cells and the exosomes and all these biologics are ironically FDA certified labs, FDA compliant labs. So they're processed properly. They come from ethically sourced donors. And we should probably talk about that as well, because I don't want people thinking they're getting something bad or wrong.
Yeah, absolutely. It's so hard to get this information. Like even me as an integrative physician, I have a hard time finding this information. So that's why I have to do these podcasts and get people to talk to me about this stuff, because it's so hard for us as consumers to know where to go to find this information. So thank you for educating us. There's must be a ton of myths surrounding regenerative
Yeah.
medicine. So what are the main myths that you would say, and what do you have like as the top things to educate us as far as that?
Well, we already took care of the myth about, you have to leave the country, because you don't. The second myth would be these come from, baby farms and or embryos. That's not the case. They come from donation services. So a patient is going to have a planned C-section, and they deliver the baby to the mother. Congratulations, here's your baby. Instead of throwing away the placenta, the umbilical cord, the amniotic fluid, they have an arrangement to have it donated, because it used to be trash, but now it's treasure. Although,
Mhm.
in some cultures, they eat the placenta or they make
Yeah.
capsules out of it and there are all kinds of things. So the placenta has all those stem cells and exosomes in it. So they save that, they provide it in a sterile way on ice to these labs who then prepare it, test it, screen it, and by the time I buy it and get it for use, I'm very comfortable with what we have. So that's ethical. That's one myth. The other myth is, this is cost prohibitive because I hear going to Costa Rica is $30,000 to get stem cells, and that may be true, but because the exosomes are so abundant in the amniotic fluid, the cost here in the US has come way down. In fact, the cost of exosomes are less than half, and sometimes even less than that here in the
Oh,
US. So you can have a regenerative procedure for a fraction of what you can have for overseas without the cost of travel, unless, of course, you want the vacation. You can turn it into vacation.
that's
So
true.
that's
Yeah.
that's one element. And the last myth is oh well, what about health insurance? Well, health insurance doesn't cover this because they use anything to deny these things, and they say, well, it's not FDA approved. But interesting, if you've heard of PRP, platelet-rich plasma, which is sort of the lowest level of regenerative medicine from your own blood, spun down and concentrated the growth factors from the platelets. That is not approved by the FDA for marketing claims, but the insurance companies finally figured out to pay for that because it's cheaper than paying for cortisone shots and surgery and repeat stuff because the PRP is so effective. So what we do with stem cells is even more effective and exosomes and so forth. So I think the cost benefit analysis is there.
That is that's really cool, and that's great to try to dispel some of this misinformation because we're all afraid of having too much costs or doing
Of
things that
course.
aren't medically kosher. So that's really really great information. I would love to hear some of your. Do you have any examples of any cases of patients that did well and that you'd like to
Yeah.
share with us?
I do. I mean, this is the fun part, right? I get to tell
Yeah,
you my best
yeah.
stories. Yeah, I have patients where we've done MRIs before and after. It takes many months for the regeneration to occur, but we've treated knees and we've seen actual increase in the thickness of the cartilage. So the cartilage is growing and regenerating in those patients. Not everyone gets an MRI afterwards because they feel good, they don't need it. We have some people where we've only gotten half, what we wanted, and we're considering a repeat procedure, but usually this is a one and done type of approach for the joints or the spine. Um, Sometimes we see immediate benefit just from the anti-inflammatory effect of the regenerative biologics, the stem cells, the exosomes, that kind of thing. On the intravenous health side, I have patients with aches and pains all over their body, my octogenarians who come in with, osteoarthritis throughout. Instead of injecting every last joint in their body, which would be just not the way to
Yeah,
go,
that's
we'll
not gonna
give it
happen.
to them intravenously, and those patients have improvement in their function. They can use their hands again. I have patients who were having failing kidneys, chronic kidney disease, with the blood tests we look at as the creatinine was going up in the bloodstream, and they were being told by their internists that they were looking at a future of dialysis. We've done, in some cases, just one IV treatment and have been able to sort of reverse that kidney effect and get the creatinine down and kept it stable with one treatment where they have not had to go back and been in danger of dialysis. So we've sort of staved off that problem because you have to go, dialysis can be 3 times a week. You got to have all kinds of vessel surgeries to make that happen. It's quite a problem. So I have patients recovering from brain injury and stroke and heart attack where we've gotten accelerated benefits that had stalled in their more traditional approach to healing, which is usually wait and rest, and do some therapies.
Mhm.
So
Yeah.
we've done that. I have patients where we've had improvement in sexual health function, where we do injections in their private areas, both men and women. Uh, improvement in sensitivity and function, in tightness of the tissues, elasticity. We have some cosmetic things we do for people for tightening the skin, and for thinning hair, we can inject the scalp. And you've heard of PRP, vampire facial. We just do the same with the regenerative biologics of a higher potential. And those are and then the breathing treatments. We've had a couple of people with chronic bronchitis, one who was oxygen dependent, had to pull her little cart of oxygen around everywhere she went. She stopped leaving the house much because of it. We were able to give her one breathing treatment and she's off oxygen, and now she can leave the house and go shopping and do the things she likes to do with her family.
So that
So
was a nebulization of stem cells?
nebulizer of stem cell derived exosomes. So smaller particles, they travel better
Okay.
and
That
they're less expensive than the stem cells. So while doing the work, so works for me.
That's pretty amazing. So do most patients have a series of, if is it just one treatment, or do they need to know that it's multiple treatments? For example, I was recently interviewing a doctor that specializes in hyperbaric therapy, and she's like, people need to know that it's not just one and done. You have to know that you have to commit to doing a series, and that's the only way that you're going to have a good outcome. What's with regenerative medicine? Is it just one and done, or do they have to have multiple? Is it different for different patients?
Yeah, it's always different. Depends on the goals. Usually it's one and we see what they get out of it. We've had joint improvement where people have no pain and they can go back to full sports. So there's no reason they need another one. I say, see me when you need to see me. See me in 20 years. So they go back to the normal path of degenerating. So then we have to see them if they ever injure it or something like that again. If it's, for example, if you're recovering from a brain injury and we give an IV and they have 30% improvement in their cognitive function, their energy, their motivation, their speech, whatever, then we might wait a while and see if we can booster that by giving them a second one. So, everyone is a case by case. The goal isn't to come in and sign up for a series of these. The goal is to have one and see what you get out of it. And if it does the job you're looking for, you could be done with it, at least for the time being.
Yeah, that's great. As a doctor, I always tell people that the less you need me, the better I've done my job, right? Yeah. I know I asked you previously about the age limit as far as how old, and you said no age limit. Is there an age limit as far as how young? Is this only available for adults? You have to be past 30, or how does that work?
Well, kids have great stem cells. The only thing I'm doing with kids right now is we do some of the breathing treatments or the nasal spray delivery of the exosomes from the stem cells for kids in the autism spectrum. We're seeing some improvement in attention and behavior in those children. So that's the only thing I'm doing for kids, and we don't really do any injections for kids.
That is really, really cool. So much to learn about all these different things that are just up and coming. Anything else that you do in your clinic that you would like to share with us?
Well, we do some anti-aging work, so it's not just regenerative medicine. We look at peptides, we look at bioidentical hormones, we look at supplements, and we try to get people off chronic medications who might be taking them. I had a woman come in who was on a steroid inhaler because 2 years earlier she had a case of bronchitis, so her doctor just never stopped it, and it was affecting her joints. So the problem is the medical system is so watered down and Kool-Aid drinking, and you called it the straight and narrow. I think it's the crooked path. And
Yeah.
I'm so glad
They
to not be
they
on
like
that
to
hamster
consider
wheel.
themselves they like to consider themselves the straight and narrow, but it's it may be a little bit different in other people's perception.
Yeah, I agree. So I'm happy to meet with people looking for an alternative path to not only meet their healthcare needs, but their health and longevity desires.
Yeah, and that's great to know. So it's not like people come to you for stem cells and you're like, okay, let's do stem cells. You look at them as a complete person. You're like, okay, I'm actually a doctor and I know all these other things, so I'm going to give you the best treatment. Even if you came for me looking for one thing, I'm going to tell you what the best treatment is. So that's the best way to be a doctor, right? I know a lot of people just they get blinders on. They say, this is what I treat. This is the only way I treat patients. So it's always
Yep.
good to realize to have an ample toolkit.
Right. To think outside the box, to think broadly, to bring in holistic things and I'll take from your field, to integrate, to look at all the different elements you can help someone with. It might be natural, it might be an herb, it might be a type of manual therapy or something.
Excellent. And if any of our listeners are physicians that want to learn more about this, as a physician, where did you get your training, or where would you suggest that we, as physicians who want to get into this topic, obtain our training from?
Yeah, I mean, there are a lot of great resources and textbooks on this, but there really aren't dominant regenerative medicine sort of organizations. There's no one single board at this time that's recognized. So you have to be creative and think out the box. I attend the American Academy of Anti-Aging Medicine annually because, or we call it A4M, because that
Mhm.
covers so many elements of what we do, including regenerative medicine, although that's just a small percentage of it. There are other stem cell conferences. Many good ones are not even in the US. So I did some training courses here in the US, and I've been actually teaching and been part of faculty on some global stem cell ones. So don't be afraid to see what's going on in the rest of the world and either take a trip, or there are so many webinars and other ways you can learn. And one good way to learn is just start simply and jump in and see if you can help people with based on the good medical evidence out there.
Excellent, excellent. If any of our listeners are interested in becoming your patient, what's the best way for them to find you, to look you up?
Well, thank you. I appreciate that. So our clinic name is now called Recelebrate because we're celebrating the renewal of your cells, of course, through regenerative medicine. And if you just use your search browser and type in Recelebrate, that's RECELLEBRATE, you'll find us. So we have a website with that name. We have, the social media accounts under that name. We have a YouTube channel. There's some videos there. So look us up and reach out. I love to meet new people and have a 30-minute, fact-finding introductory video session, no matter where you're located. We've had people come from out of the country too, but we start remotely and we see what you need. If you need labs, if we need to, and not just regular labs, but the full detailed look. If you need imaging, if you've got a new problem or a different problem that no one's been able to help you with, Dr. Monica or I love those problems, right? So
Yeah,
we'll take
yeah,
it on.
we love those cases where other doctors are like head scratchers. They're like, "Oh, I
Yep,
don't know. We've tried 8, 10 different things, can't figure this out." That's what the type of patients that you and I thrive on, right?
yep, agreed.
We
I
love
agree.
helping those kinds of patients. Wow. I love having this conversation. So useful. There's so many new things coming out that it's impossible for just one of us to know all of this. So us having this conversation and sharing these things for me is what I thrive on. Um, I'm so glad you were here today. I think this is a ton of information for all our listeners to take in. So if you could say, okay, top 3 things, these are the takeaways that we want our
Yep.
listeners to go home and understand, what would those top 3 things be?
First, the easiest thing you can do and to help prevent disease formation, to slow and reverse disease formation, to stimulate your own stem cells, to promote health and longevity would be to move and exercise. So move, move, move. We have moving parts. If you don't use them, they go bad. And when they go bad, you lose muscle mass, you lose bone density, and both of those are needed for longevity. And guess what's in your bone marrow? If you don't stimulate your bone density, you're not stimulating your stem cells because many of them live in your bone marrow.
Ah,
So,
that's
so
right.
stimulate your stem cells, stimulate your bone density by using your muscles.
Mhm.
Secondly, there are options beyond what a regular Kool-Aid drinking, AMA card carrying doctor will tell you. Because we get set in our ways. And, to some extent, I was a few years back before I made the switch to open and include regenerative medicine as a tool, even though now I'm doing mostly anti-aging and regenerative medicine because I love it so much and people need it so much and they need options. So it is one tool in addition to other tools. So I'm not saying we're going to stop all surgery, we're going to stop all cortisone injections. I mean, I'd like to work against that, but if you're not given an option by your doctor that includes these things, ask why. Why didn't you give me a regenerative medicine option? And if the doctor says, well, it's not ready, it's illegal, they give you some, you know, talk about that, you're at the wrong doctor.
Yeah,
That's a
they haven't done
closed-minded.
their
Yeah.
research yet.
Yeah. And then the third thing I'd say is restorative sleep. If your cells are not repairing during the night, and that not just sleeping, but restorative sleep, then you are chronically cycling in the wrong direction. So if you're not wearing some type of health tech, like an Apple Watch or an Oura Ring or a Whoop band, or you don't use an app on your phone that tracks your sleep on your bedside table, you can really learn a lot about your health and your longevity by the quality of your sleep. And there are some rituals you can do to help that. There are some supplements. The exercise will help that. There are so many things, not eating for a few hours before you go to bed, all these things. So your cells will repair better during the darkness of night. We're supposed to. We're like a plant. There's a dark phase and a light phase.
Absolutely. Yeah. I love all these take-home messages, especially since they're things that people can do without having to necessarily invest a penny, doing a little bit more exercise, sleeping better, not having to take. It's not something that we're telling people invest in more pills and invest in that. These are basic things that I love getting the message out, and I love helping people live healthier, happier lives. And so such a wonderful conversation to have with you. Thank you so much for being here with us.
My pleasure. Thank you for having me. And if we've helped just one person today, then we've done our job.
I'm sure it's a lot more than that. All right. Thank you, Dr. Jeff.
Thank you.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Jauregui, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feel your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.